I'm Sharon. I represent a couple of small communities in the state of Maine. I'm in the legislature, have been for a number of years, and I currently am the House Chair of the Insurance and Financial Services Committee. A public option is really what we have to do. Simplicity is important. We need to have something where it's easy for the public to access that health insurance. We have to have something where there isn't a lot of wasted money spent on administration. We need to have a seamless system where it's very easy to move from Medicaid onto private health insurance or a public option. And we need to have something that sets the standard so that we have kind of fair policies that cover everything that needs to be covered, that people don't get denied coverage because of pre-existing conditions or how, whether they're female or male. Those are all things that can be accomplished through a public option approach.
And are there any things, what are the main things that the states have done that whether in Maine or other states that you think the federal government could learn lessons from to incorporate as they move forward?
Yeah. Well, in Maine, we have had and still have the Durgo Health program, and it has an insurance option. And I think one of the things we've learned is we tried very hard to partner with the private insurance industry, and we learned from some mistakes there. One of which was we expected this private company to market this plan and comply with a lot of the ways we would like to have things done, and it didn't really happen. And that's one of the reasons I feel so strongly about having a public option, that you have the private insurers, but you also have something where you can be sure that the right kinds of policies are covered, the right there's transparency, full transparency in terms of even understanding what the policies are. I had legislation this year about the fact that you can pretty much be forced to go and buy a policy before you know what's in it. Seems pretty obvious that you ought to be able to know what you're buying before you buy it, and yet it's not really required by law, and many insurance companies make it very, very difficult for you to find out. Well, obviously, if we're going to have some kind of insurance exchange where people are trying to pick one insurance policy versus another, without that kind of information, it's going to completely fall to pieces and it won't work. So that's an example from the states where we've learned what doesn't work, what does work. We can't do it all ourselves. We would like to see really a national policy, but there are things like there's transparency, for example, or overseeing the marketing efforts that are very important that we go for, as we go forward, that we do.
In the current